The title of my talk is Association of gyrA mutation in Mycobacterium tuberculosis isolates with phenotypic of ofloxacin resistance detected by resazurin micro-titer assay. My colleague, Dr. Amar, has already given very comprehensive talk about the tuberculosis in the morning, so I'll take you through quickly, will not take much of your time. But tuberculosis, as all of us know, that is a re-emerging disease of global concern, and more than 3 million people every year die with tuberculosis. And according to WHO statistics, the dark green area you can see, they belong to the 22 high disease burden countries, which accounts for 80% of the tuberculosis in the world. And the predominant countries which accounts most of the TB are India, Bangladesh, China, Russia, and Pakistan. The question arises that we do have effective tuberculosis therapy, and since more than 50 years we are using BCG vaccination, but still the tuberculosis is a problem. So the very important or the very crucial answer to this question is the drug resistance, because the Mycobacterium tuberculosis are becoming resistant day by day, and now we are to avoid that, the therapy moved to the multiple drug therapy, and that resulted to the multiple drug resistant organisms. And from the multiple drug resistant organism, as Dr. Amar said, are the organisms which are resistant to the first line drug, at least with isoniazid and rifampicin. And the latest data from WHO says that the MDR tuberculosis are divided basically in two groups, but in the new cases it's less than 4%, and in the previously treated patient it is about more 20%. And the problem with the Asian countries is that the most of the MDR tuberculosis are there in Asia, including China and India and Pakistan, and that arises more complication because the MDR tuberculosis treatment is almost 50% successful. It's not 100% successful as in the case of the sensitive TB. And out of these MDR tuberculosis, 9%, around 10% you can say, develop to XDR tuberculosis. That is the extensively drug-resistant tuberculosis. To treat the multiple drug-resistant tuberculosis, fluoroquinolone is a key drug, and this drug is a broad-spectrum antibiotic, and thus is used to treat all the infection other than tuberculosis as well. Like you can say the urinary tract infection, the pulmonary infection, as Dr. Amar mentioned. And this drug is bind with the DNA gyrase, inhibit the enzyme. And this enzyme is encoded by the gene gyrA and gyrB, and this 3 to 35% of fluoroquinolone resistance among the MDR TB strain have been reported from across the globe. So it means that we have got less choice of the medicine for the treatment of the MDR tuberculosis. So that's why we have to take the measures to save our fluoroquinolone, and we have to have some remedies to not to use fluoroquinolone like the chocolates as we are using it in the developing countries, especially where the antibiotics are available over the counter without any prescription. So due to that, the people are already have exposure of fluoroquinolone, and if they have the underlying tuberculosis infection, their organism get resistant, as Dr. Amar mentioned. So the major concern is as I said, the use of fluoroquinolone in other infection, and the other concern is the delayed diagnosis of the susceptibility for all the drugs for tuberculosis because of the delay. Organism is slow growing, and for the same is the fluoroquinolone, that we need to have some method or some quick method and some inexpensive method which can which the people in the developing countries can afford, and which does not require the sophisticated instrument and thing like that. So the objective of this presentation which I'm making here was to assess the performance of a resazurin micro-titer assay, which is a simple 96 well plate based method, and this is an inexpensive method which requires less reagents and less complication and less sophisticated instruments. And the other objective was to identify the mutations in the gyrA and gyrB genes of the MTB isolates, which are susceptible and resistant to ofloxacin, which is one of the fluoroquinolone drug, and then compare these gyrA and gyrB mutations with the MICs of the ofloxacin determined by the REMA assay. For this purpose, the 30 ofloxacin resistant and 10 susceptible MTB strain were selected from the MTB bank from the clinical microbiology lab of the Khan University Hospital, Pakistan. And these strains were collected in the bank from the year 2006 to 2009. So all the resistant strains were selected from that 3 years, and 10 susceptible strains were included to compare the result. So these strains were all from across the Pakistan, and basically, very briefly, I'll take you through the methodology. That first of all, the organisms were cultured, and then the DNA was extracted. Then the PCR reaction was carried out. Then the sequencing was done, and then the detection of the MIC was done for the drug with the REMA assay. The REMA is basically the 96 well plate assay, as I said, and this is, I'm sorry for the busy slide, but this is the method which tell you that what is the REMA assay. And basically the organisms are in the 96 well plate, the media 7H9 broth supplemented with the glycerol is dispensed, and then the drug is diluted in each well, starting from the 32 microgram per ml to the till the 0 microgram per ml, and then the organisms are added in this, and then by the resazurin, which is a dye, is added to the medium in order to oxidation. If the organism grow, they oxidize, and then the color of the dye changes. Like if the organisms, like you can see here, the original color of the dye is blue. When organism grow, due to the growth of the organism, they oxidize and the color turns to the pink. So from the pink color, from where the pink color start, we detect the minimum inhibitory concentration for that organism. So like that, we found out the minimum inhibitory concentration for each of the isolate which was resistant to fluoroquinolone. Then we analyzed the result of our sequencing, and then we saw the mutations which was there in the gyrA gene and the gyrB gene. And gyrA gene, the most of the mutations was found in the codon 94, and which is also reported in the literature. I'm so sorry, it is, I think, the timer. Then the other codons which were found mutated were 90 and the 91, and the 2 of the isolate did not show any mutation at all, whereas on the gyrB gene we could not find any mutation for the drug. So the prevalent, the key findings from the mutation was that the organisms 64% of the resistant organisms showed mutations, and 14% had mutation at codon 90, and most of the organisms, that is around 40%, had mutation on the codon 94. The 2 isolate did not show any mutation, and none of the organisms showed mutation at gyrB. All the susceptible fluoroquinolone strain did not show any mutation in the gyrA or gyrB genes. Then we analyzed that is there any relationship between the MICs of the ofloxacin with the type of the mutation, and then when we analyzed, we found out that although there is no significant association with the type, with the level of the fluoroquinolone MICs, but the organisms with the 94 codon mutation have relatively higher MICs as compared to the mutation with the other codon. So to conclude, the early detection of ofloxacin resistance in MDR-TB is very important for the adequate therapy and control, and thus being the simple and rapid and cost-effective method. REMA method can be a good alternative method in the resource-limited countries. And although no significant association could be established between the type of mutation on codon in gyrA and the level of ofloxacin resistance, however, isolate with 94 codon mutation were higher in number in high level of ofloxacin resistance. Maybe if we increase the sample size and we have more sample, then we can find out some association here. Finding also suggests that presence of alternative ofloxacin resistance mechanism, because some strain did not show any mutation at all, and this finding was also consistent with our previous finding, in which we found out that around 40% of fluoroquinolone resistant organism did not have any mutation in the gyrA or gyrB genes. So it shows that there is some alternative mechanism working for the resistance of these organisms, because these organisms were phenotypic resistant with the fluoroquinolone. So in the future, we'll take this work up for the exploration of the alternative mechanism for the ofloxacin or the fluoroquinolone resistance in the Mycobacterium tuberculosis organism, and maybe one of the mechanism is the drug resistance pump, which we can look up. I would just like to, in the end, acknowledge my professors, Dr. Umina Hassan and Dr. Zara Hassan, who were the co-investigator in this in my study. And then AQH Clinical, Aachen University Clinical Lab, who provided space to conduct this work, and the Juma Research Lab, who provided the necessary instrument, and then the Aachen University Council to fund this study, and the Tropical Disease Research grant for funding this study. Thank you so much. Do you have any question?